Good morning, everyone. Good morning, everyone, and welcome to the speakers. Good morning to all of you who are connected from home or from your work. My name is Joseph Polimeni. I'm a doctor, and I'm currently the General Manager, the CEO at the Regional Authority for Coordination of Health Trusts in Friuli Venezia Giulia region. I think that today it is a very important day. It is going to be very interesting and full of food for thought. I'm a doctor myself, and for a long time I've been dealing with management. I was the CEO in different local health authorities. And I have to say that the HPH topic is very common. Unfortunately, sometimes it is not approached in a systematic way, and it is not perceived by managers as an important leverage to change organizations. So this debate has been promoted by Dr. Aguzzoli, whom I thank. And I think today is going to be very, very important. We have a training need stemming from the need to disseminate and consolidate the values and principles of the HPH network. And also, we have a quality strategy connected to health promotion in different health settings. HPH was created at the beginning, and it was based on hospitals, whereas today we realize that health promotion needs many more settings, not just hospitals, but other health settings at a local level. The hospital is not on a cloud. The hospital lives inside a territory, inside a network. So people working in HPH and using HPH tools must work as a network and must have a vision based on a network. We are also talking about health services here. There are many different health services which are not hospitals, or rather which go beyond hospitals. The future of healthcare will be a future outside hospitals, because with chronic diseases that we are witnessing today, with the different treatments of our patients, with the demographic change we are witnessing, the hospitals are still important, but they are not the only entity. The hospitals have to be connected with all other health centers. As I've seen in the agenda, these strategies do not only have to target patients, but have to be increasingly targeted to health professionals and citizens. And this is quite important. Today, we work on health promotion targeting inpatients and outpatients. There are some patients who are hospitalized, but then there are many others who are not hospitalized and are treated outside hospitals. However, health promotion must be done involving citizens. Citizens have to be on our side. And we need to involve health professionals, because health professionals must be involved 100%, must be informed, and must be trained on HPH. So this webinar that we have organized wants to enable the company HPH leaders to familiarize with the self-assessment tools for health promotion in the healthcare setting. And this is the title of this webinar. So what are the basic principles, the standards and indicators? I see that there are many distinguished speakers with us. So thank you to all the speakers for being with us. We appreciate that. And I believe that this self-assessment tool for health promotion made by the HPH network in 2021 and translated into Italian is a major asset, a very important tool for all of us. So at the beginning, the CEO of the International HPH Network and the international coordinator of the project, Professor Oliver Green, at the beginning, he will be presenting the standards, and I thank him for being present with us. Then I will give him the floor as the first speaker. Then we're gonna be connected with Spain and Catalonia from Barcelona. We're gonna have Dr. Cristina Iniesta Blasco, Deputy CEO of the Hospital Parc de Salut del Mar, Catalan coordinator of HPH Catalunya, ex-health delegate of the City Council Barcelona. And then there will be also Dr. Manuel Santilla Villa, physician, task force leader of the HPH Task Force of Implementation and Monitoring of Standards. And is currently a researcher at a foundation for biomedical research of the University of Barcelona. And he also led the integration of HPH standards into the compulsory accreditation system. And Catalonia has been teaching the world on that. And then we have some Italian speakers from Trento, Dr. Ilaria Simonelli, who is a member of the HPH Governance Board. She is coordinator of the HPL, the Children and Adolescents International Task Force. And then at the end, we're going to have Dr. Cristina Aguzzoli from Udine. Cristina Aguzzoli is the coordinator of the Italian HPH network. So she is very important. She plays a very important role for Italy. We have involved many different coordinators, all the regional HPH coordinators, in order to promote alignment on the activities and on benchmarking. ARCS, a company, plays the role of a promoter and a coordinator of these issues. So I'm very happy to officially open this webinar. And I will give immediately the floor to Professor Oliver Groen in order to have our first speech and introduction. The floor is yours, Dr. Groen.
Thank you, Dr. Polimeni. Buongiorno a tutti. I will speak in English. I hope that this will work with the translations. Thank you for the translators as well. Let me just share my screen. So I assume you can see my screen now.
Yes.
Perfect. Thank you very much. So let me then just start right away, and thank you very much for the introduction. From the perspective of the international network, we are delighted to be here today to speak to such a large audience of Italian health experts. And I'm really looking forward to the discussion how the health promoting hospital standards and self-assessment tool can support the implementation in the Italian healthcare context. What I want to do in my presentation is give you a bit of an overview and a background on how these standards have been developed and what kind of content they cover, and also how they are how they're constructed, because there are certain elements in the standards that sometimes lead to questions on their use. So I will try to be instructional about these standards. So let me just get started. Just for you to get a picture of who is actually working at the Secretariat. The HPH Secretariat is, well, it's a secretariat. We are supporting the member states, the member networks, member organizations, in establishing strategies, establishing action plans, preparing our annual meetings, preparing the standards and other scientific documents, and also preparing the online media presence and an e-learning community. And I'll come back to that in a moment. There are two key persons that I want to highlight that you might have had contact with. That's Karen Katsaros, that is doing a lot of the organizational work for the Secretariat, and then Lena, the right on my side, who is doing a lot of the communication work, and some other people in the background that help with accounting, with the online community, and all the other administrative tasks that need to be provided. The network is provided or is hosted by Optimedis. That's an organization that I co-lead, and Optimedis is a management company in the German context that sets up integrated care networks in which public health, health promotion, and disease prevention are put in practice. So the HPH vision, principles, tools, and standards are also something very practical that we look at from a healthcare organization perspective, to ensure that this is not just theoretical knowledge, but that it can be implemented to improve patient care and healthcare contexts. So I've been working in this field actually for quite a while. I was working for the World Health Organization in the years 2000 to 2007. And at that time, I already led the International Health Promoting Hospital Network. I then moved back to academia, and just 3 years ago, took over again the role of coordinator of the HPH network. And in this time, a lot has changed. Healthcare systems have evolved, have progressed, especially on the technology front. A lot of medical interventions are more sophisticated now. We have different technologies, but I think it's not surprising that we should ask ourselves what has really changed after COVID-19, the pandemic that affected many countries worldwide quite heavily in the healthcare system. And I think what is on the top of my list is really the impact that the pandemic had on staff. Of course, healthcare is about patients and treatment, and that's always a primary objective. But the pandemic posed a lot of stress on everyone working in the healthcare system. Doctors, nurses, everyone, drivers, ambulance drivers. And I think the impact has been disproportionate. So in terms of health promotion, we really need to reflect very carefully if we're doing enough to create the working conditions that attract doctors and nurses, that retain doctors and nurses, and that help to provide the best possible environment for healthcare. We also have seen in the last couple of years more complex care needs and technological advances, in particular the role of telemedicine. And that's a very interesting discussion, how health promotion relates to telemedicine. Telemedicine became necessary and was pushed substantially through the pandemic. And there are opportunities there as well for health promotion that we need to discuss. And that means also new models of care have emerged. We've heard that in the introduction already. The healthcare system is not only hospital-centered as it was pretty much at the time when HPH was developed 30 years ago. Health systems were very hospital-centered. Now we have a very strong primary care system, a very strong outpatient specialist services, and that requires a whole different system of organizing care, new models of care built around patient pathways. And again, we need to reflect on the role of health promotion in these pathways. And then finally, the climate crisis is a crisis that has also evolved over decades already, but I think it's really more recent over the last couple of years that the awareness was raised through the awareness on the impact of healthcare towards the climate crisis, because healthcare itself is responsible for a lot of emissions, and therefore we need to also address the role of health promotion to address the climate crisis. And all of these issues have been addressed to a large extent in the standards for health promoting hospitals and health services, and I'm going through them in a moment. Just to bring us all up to the same level of understanding of what health promoting hospitals and health services are, we have prepared a new definition that was elicited by the World Health Organization for the update of the WHO Health Promotion Glossary. Those that are not familiar with that document, I can highly recommend it. It's a document issued by the World Health Organization that describes and interprets a lot of the key concepts in the field of health promotion. And 2 years ago, we had the opportunity to provide a revised definition of health promoting hospitals and health services. And you can read that on the screen. And it's very important to emphasize that this definition goes beyond the role of individual doctors and nurses in providing health advice, health education, health counseling, support to dealing with chronic disease. These are all critical components of medical and nursing care, but the definition of health promoting hospitals really embraces the whole organization. We want to address the governance model of the organization, the culture of the organization. And we also want to address the needs of not only patients, but also the staff that I've mentioned that are working within the healthcare system, and the population going beyond the hospital or health service facility level, and really asking ourselves, what are the needs, the health needs at the population level, and are our health service fit to meet these needs? And that is an important question that is often not met. I've seen a lot of fantastic healthcare providers, particularly in the United States, where you have worldwide leading hospital services that are very close to communities where, for example, maternal mortality rates are excessively high. So you see a mismatch between a high specialist service and a community need. And all this is being addressed by the new definition of HPH. So our network is a large network of networks. You can see here currently 19 national and regional HPH networks operate under the umbrella of the international network. We have around 600 members. The exact number is changing from week to week because we have got some new members joining and some are leaving. So it's around 600 members that we have, representing 33 countries. And we are very pleased that the Italian network and networks have been very strong supporters of the HPH movement since the beginning, since the inception. I remember even 20 years ago, when I first had an exposure to the health promoting hospital network, the Italian networks were among our strongest supporters, with various regional and national initiatives. So thank you very much for all the support the Italian colleagues have given to the international work. What is changing is that in the past, our members were exclusively hospitals. With the change in the definition of what health promoting hospitals and health services are, we have allowed members other than hospitals to join the network. And that's very important to address the care pathway from a patient perspective. We have now members that are primary care facilities, that are pharmacies, that are community organizations, and these members, together with the hospital in the catchment area, can provide a holistic, a comprehensive service to the population. Therefore, we really encourage other members than hospitals to join. Of course, hospitals continue to be very welcome. They are the cornerstone of the network, but it would be fantastic if all our hospital members could attract some of their health service partners to the network so that comprehensive care pathways could be planned and developed further within the international network. This is just a list of members and the current single members and regional networks. And you can see here we have Piemonte, Venezia, Trentino, Emilia-Romagna, so various Italian networks represented at the international level. Now, coming to the standards, the HPH standards have a long history. I actually had the privilege to lead the design of the first standards in the year 2005. And I worked at WHO with an international working group to develop those standards. And then in the last 15 years, we had various task forces and working groups that developed standards for specific areas or target groups. Say we have the standards for children and adolescents. That is the work led by Ilaria. We had Ilaria Simonelli. We had the work on the migrant-friendly hospitals and migrant-friendly standards that was led by Antonio Ciarenza. And we had some other working groups developing standards for age-friendly healthcare, for climate impact, and also for health-literate organizations. So the field of the standards became a bit overwhelming. And 5 years ago, the General Assembly of the International Network decided to produce a single document that embraces the key components of those standards and integrate them in one document. And this one document is the 2020 standards for health promoting hospitals and health services. It is also related to some broader documents that were developed at the international network level, namely the Global Health Promoting Hospital Strategy and the Action Plan. And the Global HPH Strategy sets out some overarching aims for the network for a 4-year period. And these aims are also reflected in the standards document. The document then describes 5 set of standards. Overall, there are 86 standards that are mapped on these 5 different standards. And the first standard addresses the role of leadership and management of the organization. It's called Demonstrating Organizational Commitment for HPH. We don't want HPH to be a lip service. We want in the standards that the key leadership team supports the vision of HPH. And that means that this is reflected in the vision statement. It's reflected in the yearly action plans. It's reflected in assigning responsibilities for health promotion. And these are all standards that are covered under Standard 1. Then Standard 2 looks at access. Access is here meant not only to be physical access, that's also very important, particularly for people with impairments and handicaps, but access also in terms of the cultural environment, the linguistic environment, navigating your way through the system, finding the service within the hospital system, and also understanding written and oral communication. Particularly written communication in healthcare, but also oral, can be very complex and difficult to understand. Standard 3 addresses people-centered healthcare and user involvement. So these are the most traditional areas of health promotion. It addresses patient education, information campaigns, but also acknowledging the patient as a person, not just as the hip in bed 6, but actually Mr. or Mrs. so-and-so with a history of labor that led to the hip problem. So the comprehensive awareness of the people in the healthcare system, but also user involvement, giving the users, the patients and people an opportunity to actually actively contribute, not just to their own chronic disease management, but also to the design of health services. Then standard 4 is the very important standard addressing the working conditions for staff. Oftentimes, hospitals in particular might be busy environments, noisy environments, badly lit environments. They might have an odd smell. The design is not really often addressing the health needs of people. So we are addressing under standard 4 the health needs of the staff. And that covers nutrition, exercise, but also psychosocial stresses, and really the involvement of staff to create a healthy workplace, a workplace that is attractive, that people want to continue working in, and that we can retain staff. And then the last standard looks at the role of the health service in the wider society. Here we cover the links of hospitals to other health services. We also cover the links of health services to the needs in the population, in the catchment area, and also the role of the health service in terms of climate change, in terms of water, energy, but also local procurement of food, and encouraging healthy behaviors. So these are the main headings for the new standards on health promoting hospitals and health services. Now, when I present these standards, I'm often asked how they were developed, because it's an important guiding document. And of course, people want to be ensured that this is based on a robust evidence base. And I can assure you that we had a very, very ambitious and demanding process to design these standards. First, we had a literature review on the role of different standards in evidence. We had all the work from our task forces and working groups looking at specific action areas: children, migrants, elderly, health literacy, and climate. And Dr. Antonia Chiarenza some years ago prepared a first mapping of these standards that led to the development of these new standards. When we led this work on the development of the standards from the International Secretariat, we believed it was important to involve, or to give everyone an opportunity to get involved. And therefore we designed 2 Delphi panels, or better said, a Delphi panel with 2 rounds. And you can see here all the different steps that were followed in the Delphi panel. We proposed the content, we proposed standards, we invited all network coordinators, all task force leaders in contributing to this refinement of the standards, and used various working group meetings to propose the final list that we have now. And this is the document that you might have seen. The right-hand photo or image gives an indication on how the standards are structured. So we have a standard 1 and a title of that standard, in this case, demonstrating organizational commitment. We've got an objective of the overarching standard. So what is the standard aiming to achieve? Then we've got substandards, so different domains of the standard. And what you can see here under 1.1.1 as an example, that is actually the standard statement, the normative aspect, what should be in place. And then underneath the standard, you've got measurable elements, and these are indications of evidence that could be assessed when reflecting on the compliance with the standard. And then you've got a rating scale where teams can reach consensus whether a standard is implemented, partly or fully implemented. And you've got a note section where you can write down qualitative comments. And that is really meant not so much as an external assessment tool, but as a tool to help reflection and discussions in a local health service. We've also designed an Excel spreadsheet with the same content, but where you can enter your ratings directly and get also a visual representation. Just one more example to illustrate it further. Here we've got standard 2, ensuring access to the surveys. With the overall objective, it addresses availability, accessibility, and acceptability of the facility. So here you've got again the domain and a substandard, a standard statement, what should be in place. Here, for example, that the organization has a procedure to assess and provide support for people where ineligibility or lack of resources compromises human rights. That is a complicated phrasing, but it means that we have, for example, migrant without defined status in a country, which in principle are ineligible in some countries to seek healthcare. And the organization needs to have a procedure what to do with such patients if they present at the door and seek healthcare. It doesn't mean that the organization needs to go beyond legal aspects of providing care, but it needs to have a procedure to take a decision who should receive care and who should not. And I know that the eligibility criteria differ a lot between countries, but always remember when you read the statements, they are built on an international evidence base. There might in fact be standards where in your network or in Italy, you might say, this is not applicable to us, and that's perfectly fine. You can just write it down as not applicable. We're very pleased that the standards have been documented or translated already in 11 languages. Italian is one of the languages that has been translated to, and we've got further translations coming up. Now, I want to come to an end and share with you some exciting development that our General Assembly members will be well aware of. We are aware that the standards lead to a lot of questions. Now, the standard statement provide content on what should be done in healthcare or in health promoting hospitals. It gives some indication on how to assess it through the health assessment tool, but it doesn't tell you what to do. It doesn't tell you how to improve. It doesn't give you an indication on what have others done already in the field. And we know that in the HPH international community, there are a lot of good examples of member organizations that have already implemented some of those standards. So we want to bring this knowledge into an overarching e-community platform. And this platform has now been released in the first version. The access codes in a primary step will be sent out to our network coordinators in the coming weeks. And through this network platform, you will be able to ask other member hospitals, have you already have some information how we can improve on this part, on these standards? Or for example, if I use the example on the access standards about the procedure to assess eligibility, there might be another hospital that already has developed such a document. So you could ask, who has such a document? Can you share it with us? And then we hope that this community will really facilitate the implementation of the standards by bringing in all the knowledge from the international network. I also like to refer to you our website, where you can find a lot of resources, documents, guiding documents, these standards, but also particularly I'm encouraging our members that are not represented in the General Assembly or in the Governance Board, because you might think, what are these people actually doing in those meetings? And we have now, since a couple of months, put all our annual reports and General Assembly meeting reports on the website. So you can also read up on the discussions we are having at the international level, if you're interested in that. And there's an opportunity to also submit questions to the Governance Board if you have concerns about the network, about the benefits, about the directions, and we really value your feedback. With that, I'm coming to an end. This is just the list of the task forces currently active. And I really thank you for your attention. These are contact details of the Secretariat. Please let us know if you have any questions and reach out to me and my team with your ideas and thoughts. Thank you very much.
Benissimo, ringraziamo il professor Oliver Groen per la sua dettagliata e...
We would like to thank Professor Groen for his very complete and thorough presentation. And in particular, I really appreciated what he said about the HPH network and how he stressed its importance and also its composition. And especially after the COVID pandemic, we see that there is a shift on the territorial level. This is a very important aspect. The standard number one, the one showing that we really need to have a commitment. So there must be an organizational commitment, the commitment to the organization. This is extremely important. Being a public healthcare manager, I think that this is really a strategic and crucial element. And of course, even the goal of setting up a community is another equally important, relevant aspect for the success of the network. There is a question that has been written by one of the participants, and I would like to ask it to Professor Groen. So Mr. Giuseppe Fiumano asks a couple of things. First of all, he would like to have a bit feedback about the mental health issue. So the question for Professor Groen from Mr. Fiumano is the following. So when it comes to these standards and to these network implementation elements to guarantee the monitoring, do also consider specifically mental health as an issue? Because we know that after the pandemic, especially, mental health disorders have increased. They have literally boomed, also at very young ages. Also, when it comes to teenagers, I have two adolescent kids, and I must confess that the pandemic brought about a good amount of trauma in young people, but also in the elderly, because very often they were left alone in their homes. So this is a first question about the role played by HPH when it comes to mental health. And also, secondly, on the healthcare practitioners' mental health, because even them, they underwent a lot of trauma during and after the pandemic, because for them, it was a pretty hard experience. They went through a rough patch. So these are the questions. So Professor, the floor is yours.
Thank you for all those questions. They're two very important topics. And I can share the same experience. I also have two daughters, 10 and 14 years old. And they, of course, also have their experience of the pandemic and a lot of their friends as well. Luckily, nothing serious, but this has been in a situation that I think none of us have ever experienced before, that these young people were isolated to an extent that is absolutely not aligned with their needs at that time in their life, bonding, establishing friendships, meeting, running, being outside, and all that has substantial impact on the mental health of young people. I know from statistics that the mental health is rising disproportionately in the younger people at the moment being diagnosed. there's a substantial demand for psychotherapy, to bring people back on track to dealing with anxieties, anxiety attacks, and I think there's probably an avalanche of health problems that we will experience in terms of mental health, and that of course affects not only the children but other sectors of the society as well. There is a specific standard that looks at health needs assessment in patients and health needs assessment also in children. It's specifically under 3.1.3 and 3.1.4. There are two specific standards that look at guidelines to identify mental health risks, because what the problem is, often people, whether it's children or adults, come to see somatic care in a healthcare organization, but a mental health issue remains undetected, and that is a problem. So healthcare organizations need to have a procedure in place and train their staff to detect those mental health issues for somatic patients, and that's something that is addressed in the standards. The other point that you mentioned about staff health, again, I've referred to that earlier. Here we don't talk so much about mental health, but awareness on staff health. Because what my experience is that often, particularly during the pandemic, the attitude was, well, you just have to go on, you just have to deliver. That is something in the ethos of the professions, to go on and to deliver, often beyond the own need. And that has affected many doctors and nurses to the extent of burnout, mental health and physical health. And we have specific standards in place, even one specific standard that looks at identifying procedures during particular situations such as a pandemic, to make sure that even in a pandemic context, if it came again, we would have a process by which we can keep an eye on staff health to prevent burnout, and to do the best possible to create a work environment that doesn't lead to disease and burnout amongst those that are working in those settings. So the questions are very relevant and addressed in the standards, probably not fully, but we can't go into each and every detail in the standards. The standards also have to be concise. There are already 86 different statements, but I think we have addressed all those issues, and it is then the role of the healthcare organizations to see what you can do locally to address these issues, preventing that staff reaches a level of burnout, and preventing that mental health issues, for example, in somatic children that are patients, is overseen.
Bene, molto bene, credo che le risposte siano...
Thank you very much indeed for your extremely complete and exhaustive answers, Professor Groen. I see some other questions, and well, there is a question by Mrs. Brunelli. To your knowledge, are there experiences? Ci sono...
Internationally? Beh, questa è una domanda che credo che però abbia già risposto il professore, perché ha detto che chiaramente questo è un elemento forte, cioè gli standard HPH devono essere progressivamente...
I think that you already answered this, because HPH standards need to be gradually implemented and applied to accreditation processes. As far as Italy is concerned, we have two accreditation modes. We have institutional accreditation that is compulsory, that is managed by the regional and state level, and then we have the so-called excellence accreditation procedure. Many hospitals in Italy have been accredited by the Joint Commission or the hospital accreditation organization. So the rationale applied was different, but it goes without saying that HPH standards require a good level of integration with the accreditation processes and procedures of hospitals. So thank you very much again, Professor Groen, for your collaboration and for your speech. And now we can move on, and let's now talk about the standards for health promotion and accreditation in the Catalan health sector. We have two speakers who are going to take the floor one after the other. So Mrs. Cristina Iniesta Blasco is going to have the floor first, and then Mr. Manuel Santina Villa. So Mrs. Blasco, the floor is yours. Good morning.
Buongiorno. A nome della rete catalana.
Good morning. On behalf of the Catalan Network, thank you very much for the invitation. And upon suggestion of Cristina Agnoli, thank you very much. We always had very stronger and close relationships with our Italian colleagues, with Mr. Antonio Cerenza, the members of the International Network Council, and with Ilaria Sivonelli.
600 members from more than 25 countries, but we believe that we share the Mediterranean culture. We share our values and behaviors. So thank you very much. Let me introduce just a little of our network. How did the Catalan network start? Was in since 2003, different individual initiatives of Catalan hospitals participating in 3 task forces. One of them was promotion standards, the other children and adolescents and immigration. Was 5 years later, one in 2008, was the Constitution. Here you can see the Constitution with the Minister of the Health in Catalonia. And our network, has always aligned with the Catalan Health Department. We have 23 members and also 2 important health partners. From the health department, we have the public health, the health promotion, the promotion of the strategy, and also the Universitat de Girona. These 2 health partners always are close of us. We have a permanent commission with 7 members and 2 advisors from the health department and from the Universitat de Girona. We meet monthly. We have a strategic plan and we follow up the Catalan health plan. What is our challenge? Our challenge is really difficult because it's incorporate health promotion into the organizational culture for patients, for professionals, from community. That means just in the day of our organizations, but also we promote research and also the docencia. Here you can see our strategic lines and you can find more information in our website. One is health literacy, health at work, and health standards. Let me just briefly highlight the navigability from our centers. We have the working group that has been evaluating for more than 10 years, the circuits, the signs. Also an important campaign, Health Without Doubts, related with the Ask Me 3 questions, related with all kinds of communication for our organizations. And here, important, safe and healthy work environment. Was during the COVID that our network sharing the best practice, for patients and for professionals. And we are really, really focused on the well-being of the professionals. Related with the standards, later Manel will explain, but here you can see that we have translated in Catalan the standards, and also we have influence in the Catalan Health Department. Manel will explain. And we have done different webinars during these 2 years of the pandemic, and 2 of them was really good attended, was the implementation experience for the standards and presentation of the standards 2020. And before giving the floor for Manuel, let me show you two images of my hospital. You can see on the left, this is a patient who spent 3 months during the pandemic COVID in the intensive care unit and asked to the team to go out to see the sea. You can imagine 15 years ago, a patient that's in the intensive care that goes to see the sea. And close in the on right, you can see a dog that it's to see its owner. It came to the hospital to see the owner. So 15 years ago, later, I believe, or we believe, that we are improving and introducing health promotion and well-being in the hospital for patients, for professionals, and for community. And now Manel will explain our experience in how we have influenced the standards in our organizations and the health department. Manel, when do you want?
Il microfono spento, scusi.
Please, Mr. Santinavilla, okay.
Good morning. First of all, thank you for inviting us at this webinar, and especially thank you to Doctoressa Agussoli. Cristina, thank you to think your Catalan fellow for this training activity. And the first slides are only to put in context what we have and are working on in the Catalan HPH network. As you know, Oliver Groen explained widely about this. In 2021, the HPH in the governance board approved and published the 2020 standards for promoting hospitals and health service. You can see all the information that Oliver told you in the website of the HPH network. Remember, the 2020 standards include 5 overarching standards. Only 4, remember the titles. Demonstrating organizational commitment for HPH, very important. All are important, ensuring access to the service, enhancing people-centered healthcare and its involvement, creating a healthy workplace and health setting, and promoting health in the wider society. All these 5 big group of standards include 86 sub-standards. You remember the 2020 standards have been translated in different languages: English, Catalan, Finnish, Farsi, French, German, Hebrew, Italian, Japanese, Spanish, and Swedish. And some of these pieces network have developed or translated a tool to facilitate the self-assessment that you can find in the HPH website also, English, German, and Italian. Therefore, to publicize the standards and facilitate the use, and this is necessary. But the challenge for the HPH network, for the organization in general, is how to introduce health organization, is how to introduce and to implement the 2020 standards in the organization, attending on the complexity of the health systems, all the health systems in the...
Sì, buongiorno, sono Claudia dell'Enjoy Events.
I don't know what... Tell me.
Allora, lei è sul webinar, giusto? Allora, praticamente lei dovrebbe trovare
Spenga
in
il
basso...
microfono di Enjoy Events, ci sentiamo tutti, spenga. Prego, dottor Manuel Santigna, prego.
Dr. Santigna, please go on. Thank you. Sorry. Thank you.
All health systems in all countries are different, have difference, and this is complex. In the case of HPH Catalonia, in our network, we created a working group, and Cristina Iniesta say you what I this, a working group that we name Health Standards. We aim to help our centers to implement these 2020 standards. This is the reference of our website, and this is the website. Okay, the website it's only in Catalan or in Spanish. I need to explain something about the Catalan health system, our health system. In our health system, the health administration have the authority to accredit the healthcare centers if they want to work in the public health system. This is mandatory for public health organization and for private health organization also if it's want to work in the public health system. Accreditation is the health administration way of ensuring that the healthcare organizations meet a set of standards with the aim to providing quality healthcare. Because of this, the health administration has developed a model of accreditation adapted to the characteristics of the different healthcare lines as acute hospital or primary healthcare. The slide you can see the reference of the website of our health administration, the GenCat, at the different lines that the health administration developed accreditation. Coincidentally, in 2020, the health administration had started a process to update the accreditation model for acute hospital, and we saw the opportunity to introduce health promotion standards into the model. Until then, there were no health promotion standards in the accreditation model. Therefore, we prepared a proposal to present to the Department of Health, the health administration name. In the proposal, we explained the relevance of including health promotion standards in the Catalan accreditation model and indicated which would be the main standards that should be included. We prioritize the standards that value the organization's commitment to health promotion, the standards 1 of 2020 HPH standards. We prioritize these standards that we consider most important to incorporate into the accreditation model in accordance with the objective of facilitating the deployment and implementation of the whole. It was completely unthinkable to be able to manage to include all 86 sub-standards that make up the HPH 2020 standards. We believe that if we could get the health promotion standards to be included in the update of the acute hospital accreditation model, we would facilitate their implementation, given the mandatory compliance with the model. The introduced standards would act as a spearhead to facilitate the introduction the rest of standards in the acute hospitals. The Public Health Agency of Catalonia, a partner of HPH Catalonia, gave its full support to this objective. It certainly helped a lot to achieve that. The Public Health Agency is a part of health administration, and health promotion is one of its activities. Finally, we will achieve to introduce 7 standards in a specific conceptual grouping, titled this, Involvement in Relation to Health Promotion. EC04 is the code of this conceptual grouping. This is, we seek a specific area of into the model to talk about health promotion. And this was complemented by another 2 standards included in the conceptual grouping, involvement in relation to society, and another 1 standard in the conceptual grouping, attention to people. This is in the next slides, you can see the descriptions of the different health promotion standards that we achieve, including in the accreditation Catalan model for acute hospitals, only in this moment for acute hospitals. The first you can see is the code that all each standard has. The first is the organization has a working health promotion policy and the promotion of healthy habits aimed of patients, family members, professionals, the community, and the environment, approved by the executive management. The second is the organization has a collaboration plan with other health services and sectors for health promotion. The third is the organization provides patients with information on important factors related to their illness or health problem, and relevant health promotion actions are carried out in the patient's trajectory and treatment. 4, management establish the conditions for the development of safe and healthy workplace, health promotion activities for the staff, and the acquisition of staff health promotion skills. 5, the health promotion policy is implemented as a part of continuous improvement focus and improving health outcomes. And 7, the organization monitors the health promotion policy as a part of the center's quality improvement system. 8, the organization ensures that the health professionals, together with patients, systematically assess the needs for health promotion activities and the associated risks. Next, the organization implements programs to promote health and healthy habits, health protection, sustainability, and social responsibility. The other is the management promotes the implementation and dissemination of health promotion programs, supports them and actively participates in them. And the last is management and leaders plan action aimed at promoting and protecting the health of staff in their work area. At short term, this fact means that the 68 acute care hospitals of Catalan system are now working on health promotion standards in line with those of the HPH. The 23 hospitals in the Catalan network can work with the rest of the standards more easily. The Catalan network can more easily split health promotion standards in the Catalan health systems. Why? Because there are 10 of mandatory components, 10 of standards that are mandatory for the health administration. Because the health sector talks about health promotion and how to implement its principles and objectives in health organizations, and the use of HPH standards facilitates and systematizes this. The HPH Catalonia, through the standards working group, have been working. They translate, this group translates them into into Spanish and in Catalan language. We translate and adapted, very important, adapted the language of speech standards to that of the Catalan health sector. They have held different webinars to share the standards with health professionals with the aim to facilitating knowing. And they have working to make the standard easy to understand and how to put them into practice it. What have we learned about all this work that we have done? To introduce health promotion standards in health organization, an agreement must be reached with administration, with health administration. This is very important, very strategic to achieve this. Better to act as a group than individually. Importance to have a working group to lead this action. The endorsement of the administration makes it easier for the management of the centers to collaborate in the use of the standards in the organization. And the health promotion standards are easily integrated into a quality accreditation model, which is a good strategy to introduce them into organization. Usually, when the organization working in healthcare quality, improve the quality of our station, we also work in objectives that are similar to the health promotion standards. Grazie mille per la vostra attenzione.
Molto bene, molto bene.
Thank you very much indeed. Mr. Santigna, thank you. Your contribution was extremely encouraging and stimulating, and these joint presentation gave us a very good snapshot of the Catalan situation that is pretty relevant on the international scenario. And the slide entitled "What have we learned?" is very important because it shows very clearly some take-home messages that are pretty important and strategic. I would like to recap them again. So certainly the management commitment is key, because if the management does not believe in such initiatives, I mean, there's no point, because the management is the one deciding the guidelines. So the management commitment is really crucial for the success. And then team building strategies are also very important, because working as a group is always better than working individually, because I mean, individually you can just make a few steps ahead, but to go ahead in the long term, you need to be a group, to work as a group. And I was very touched by the two pictures showed by Mrs. Inés Blasco. So this dream that was not possible 15 years ago. I'm a big dog lover, big dog fan, and so seeing those two pictures really moved me deep down, because they conveyed a lot of emotion, and emotions are very important. I remember Professor Veronesi, whom I have had the chance to meet at the Cancer Institute of Milan. He wrote a beautiful book entitled A Caress to Heal, Caressing to Heal. And he said that sometimes even healthcare practitioners need to find the time to listen and to be empathetic and to be closer to patients in an emotional way. And it's not always the case. I really, really appreciated your joint presentation that gave us a lot of food for thought. And well, I think we are perfectly on time. We should stick to this. So I would like to give immediately the floor to Professor Simonelli, to Mrs. Simonelli, who is going to tell us more about the specific children and adolescent sector when it comes to health standard promotion. Thank you. Thank you very much. And good morning, everybody. I would like to thank Mrs. Aguzzoli and the organizers for this invitation. And I would also like to thank the previous speakers because I think they really outlined a very clear picture when it comes to the strategies and implementation. So I will try to focus on one of the many aspects that the HPH task force dealt with to promote the health in children and adolescents. And this has to do with the standards applied to this target population. Well, our task force has been active since 2004 when it comes to the HPH network. And our mission is pretty specific. We promote the health of children and adolescents. We try to outline specific strategies and tools aimed at considering the needs, the specific needs of these population group, trying also to influence decisions making in strategic corporate and political organizations in order also to strengthen our implementation capacity. Our task force is pretty large and we are international task force operating from the US to Europe to Australia. And I always try to thank constantly the other task force members that help me coordinate this working group. And we always refer to some key principles when it comes to international organizations that have already expressed themselves about the importance of promoting health in the population at large and in children and adolescents. I'm referring to some declarations about what health is. These declarations are being somehow updated. So health is a status and health can be considered as a sort of a very precious asset. So, and Antonovsky would frame it as the shift from extreme well-being to extreme, not well-being. And then we also have the Convention on the Rights of the Child of 1989 that also includes the right to access healthcare services in a broad meaning. And it has to do with the rights of the child, not only in terms of theoretical principles, but as real standards that need to be promoted and implemented. And then there are some health promotion milestones. You don't see it here, but there is also and always be the Ottawa Charter, the Budapest Declaration. So here you see some key references, and we decided also to include the New Haven recommendations of 2016 because they certainly focus on the element of participation, of involvement. So enabling patients and families to actively participate, to be involved. It is up to us to give them the tools to make this involvement as easy as possible. So we should do that at micro level in terms of service provision, in terms of service delivery, but also in terms of planning and organization. So trying to involve, the population at large in very practical planning services, also when it comes to the service delivery. So involvement is really strategic, more and more. And also we constantly refer to other key standards, for instance, the WHO 2015 standards that helped it very, very much to navigate much better through the definition of the standards. These are key assets ranging from evidence-based care. We always refer to evidence-based care when we plan and offer services, but also specific communication strategies aimed at children and their families need to be considered and need to be effective. They need to be adapted to their level of understanding. So again, this is another key aspect. And also we need healthcare professionals and practitioners to be motivated to be more and more patient healthcare oriented, so trying to do their most to promote the healthcare of the patients. But as our CEO said in the beginning, it's not just about hospitals, it's about communities at large. Our main reference document when it comes to defining the HPH children's standards was document of 2005, the one for the promotion of health in hospitals. We finalized ours in 2018, so slightly before the next update. I don't want to go into details because Professor Groene made a wonderful presentation. And so I just want to mention this reference document that we used to define our own standards. So de facto, we worked considering the 5 key areas from management, policy to continuity and cooperation. Then we went on through the involvement of children's hospitals or general hospitals with children's sectors from Europe from ranging from different countries to Hungary, to Estonia, to Italy, to Spain, to the US, and also so Professor Centina has been involved, and at the time the governance board has a contact person devoted to our task force. And we also have the Vienna and Copenhagen WHO cooperation centers. And then we also defined the standard document. So we focused on the sources, and then we wrote some drafts that were made circulating through the participants. And then we planned to tool testing sessions, and then we moved on to the final document, and then we implemented it and disseminated it at international level. Well, we have worked within a specific framework when it comes to the standards indicators for health promotion of children and adolescents, and the framework is the following. So hospitals and health services that need to use this tool to promote specific health targets in children and adolescents. So the main goal has always been to be to offer a tool measuring the well-being level of children in hospitals and health services, but also to support professionals in peer-to-peer assessment of the level of achievement of health promotion in hospital and their services. So the idea was to have a checklist to be analyzed with a peer-to-peer approach to see the level of compliance with the specific standards being considered, and also which are the areas of improvement to promote children and adolescents' health. So the first draft was prepared to be revised by the WHO collaboration centers. And then we made 2 tests. The first one was very practical, and it directly addressed healthcare practitioners in order to see the best implementation strategies. The second test was an online survey to understand the level of feedback from professionals in terms of understanding and acceptability of the tool. So we got a very interesting outcome. For the first test, for instance, we saw that the presence of information materials and of official health promotion documents addressed to children were the only two standards with respect to the ones that we had defined and proposed with the good or high levels of achievement. What does this mean? This means that, well, as a professional, I can tell you that when it comes to information materials and documentation, the friendly language used for children was well positioned. And most of all, we saw that professionals were keen to use these materials as a supporting tool, as a checklist. So there was a very good level of application, even though it was not the, let's say, advised and expected level. So we know that all the professionals are already overwhelmed with a lot of things to do, a lot of tasks. So sometimes this kind of work is seen as secondary with respect to other services and actions being carried out. The results of the second test were similar and went in the same direction. So there was a critical result on the comprehensibility and importance level, especially related to participation and rights aspects. So on the one hand, we saw that they were considered as a tool to facilitate children and families' involvement. So when the tools start to say that, well, is the right to privacy being complied with? Is the right to being complied with? Well, then the assessment is harder. It's harder to better understand what are these rights, especially when a specific healthcare proposal is made. What is the right to play, especially when a child is hospitalized? How can I assure that as a practitioner? Well, in these cases, the understanding of the standards was found more complex. Another key detail that has been considered as strategic for the tool dissemination was the simplicity. The shorter, the better, and certainly, according to professionals, these are key elements to facilitate implementation. Well, after all these preparatory work and testing and assessing, we defined through the 2005 document the standards designed for children and adolescents. So we defined some goals that you see here, so including health promotion activities for children and adolescents in the organization's quality system. This is the first goal. The second goal was the systematic assessment of health promotion needs of children. So trying to start to assess these children's needs, and then empowering children and adolescents in an active partnership with health professionals and facilitating the integration of health promotion activities in all patient pathways, taking into account the patient's levels of maturity. So when it comes to maturity, we have a specific communication strategy matching the specific age of maturity. And also we need to promote a healthy, safe, and child-friendly workplace. And also we need to guarantee the collaboration with the relevant health and social services, and also to start partnerships to integrate health promotion activities in other local settings. Well, we found a good level of consistency with the WHO standards of 2015 when it comes to the evidence-based management, when it comes to the children's rights. Well, apart from the critical element of understanding of the real implementation or implementability of these rights into healthcare rights. And it is also very important to have staff likely to talk to children and their families. They need to speak a language that can be effective when it comes to communicating with children and their families. Then we prepared some tips for the implementation, differentiating between structure, process, and outcome to show how different standards can be implemented considering the different sectors, so the management side, and then the interaction between practitioners and patients, and the last area was the changes in individuals and populations in terms of effectiveness of the applied standards. You also can find on clinical health this document published on clinical health promotion, and then we have come to some conclusions and recommendations of the standards document. So tools need to be simple. This is a pretty clear recommendation coming from all professionals in order to make these tools more attractive. We also need to improve children's and families' involvement in order to improve their health management, but also to improve the healthcare planning. We also need to enhance professionals' attention to health promotion as key aspect of quality of life in hospitals and healthcare services. And so this is a strategic element that is really key when it comes to policy design. And also we need to promote children's rights and needs in hospital settings. So these are the four main conclusions and recommendations that we drafted at the end of this process. And well, I would have some questions for the participants if I can, or if we are getting late, I can move on. Just let me know. Well, I think that we can do that. I know that Mrs. Aguzzoli had also prepared some questions to submit to the participants. I don't know. How do you want to proceed? Can we do that at the end? Okay, okay. Let's keep that for the end so we can then have a short discussion. Okay, I will come to the end of my speech saying that our standards have been adopted by some countries, including Taiwan, that integrated them into a project financed by the Ministry of Health. So we were very happy to know that. So knowing that our work has been useful for professionals was a very satisfactory thing. Here you see the website of our task force. I also thank the International Secretariat for having systematized our contents in a brand new website. So please do not hesitate to visit it. And then, well, our main challenge is still about the increase in the level of participation of children. So we really want to increase their level of involvement when it comes to communication, when it comes to planning, when it comes to the relationship with the healthcare professionals, because they need to be involved. And the healthcare practitioners' communication style needs to be improved. They need to use a new language. And some already do that, but some don't. So there's still I mean, a great area of improvement and a lot of margin of maneuver. So we need to keep working on that. And secondly, when it comes to conveying messages to children, we need to make sure that they got the messages and especially that they really understood what was, behind those words. And we're also carrying out specific activities to support the standards implementation at an in-house level. We have just completed some work on hospitalized children, and we have created a working group on that. And also we have joined some international projects like Born to Read and Born for Music. They try to always support children's access to specific services. And together with the Clinical Governance Service, we are joining a European project that is very, very important because it's addressing the needs as a category. So it's not a traditional healthcare service, but it has to do with a much broader scope, including social and work inclusion. And so it addresses adolescents. Sometimes, we're not able to tap into our radar. So these are several activities that we try to carry out to support directly these internationally approved standards. So here you see my email for any further information or question or curiosity. So do not hesitate to get in touch with me. I thank you very much. I don't know if you were going to have time for questions at the end for our pool or otherwise. Thank you very much indeed. Thank you. Thank you, Mrs. Simonelli. Thank you very much. You were extremely clear. Thank you for your suggestions and ideas and also for the information that you passed on to us. And certainly we will have some time at the end for the discussion. So let's move on. We still have another 30 minutes and maybe we will have a 10 minutes discussion. So Mrs. Agusoli does not need any presentation because she works in my unit. So I think that you all know her, at least at national level, but maybe also at international level. So Mrs. Agusoli is the coordinator of the HPH network for Friuli Venezia Giulia region and also the coordinator of the Italian HPH network. So I give you the floor with great pleasure. So 20 minutes for your speech. Thank you. Thank you.
Grazie, buongiorno, c'è solo un attimo, devo interrompere la traduzione del...
Scusi, l'interprete deve cambiare canale.
Ah, grazie, forse quello è il problema.
Okay, good. Sorry. Yes, can you... Thank you very much to the colleagues who have spoken before me. They are wonderful professionals and dear friends of mine for the past years. I've been coordinating the regional network in Friuli Venezia Giulia, but I have also been working at international level with my friends. So thank you very much to you all. And thank you very much to ARCS, who has given me the opportunity to give this presentation. My task is to focus on Italy. There's the Friuli Venezia Giulia network. There's a network in Trentino, Piedmont, and Emilia-Romagna, and many other health organizations in Lazio, in the Lazio region. We have national and regional websites. A regional website that I'm managing in order to make available all the documents that we have been translated over the years. We are basically working on patient engagement and operators' well-being. Here we can see that we have the same organizations as the one existing at international level. We have the general coordinator for the Italian networks, managing the regional networks. And then we have the different regional committees and companies committees to focus on the different topics. Also, there is a steady cooperation with the Health Institute on the well-being of health operators. Here you can see the names of the people who are in charge. Many of them have been working for a long time with the HPH Italian network. Today, we are sharing our strategy on standards. You see, we have many different participants from all the Italian regions. In our region, on the 27th of April and on the 4th of May, we will have a training with 35 participants that for the first time will be able to use the manual. And the self-assessment will be made in September 2023 by the different companies. This is the materials that we have translated into Italian. They are available online. On the left, you see the comprehensive brochure. On the right-hand side, you can see one page of the brochure, and we have translated the global strategy and the action plan. These are the self-assessment tools that have been developed in Friuli Venezia Giulia. And they focus on the emotional, psychological, social, and organizational well-being on the place of work. This topic was already an area for interest in 2008 when a dedicated law was enacted. And then we have been working on them, and we have translated the self-assessment tool, which is now also available in an Excel sheet, so that we can have the different forms of the self-assessment. Why is this important for us? In order to have a map of resources, of assets, it's not that we have to be good or not good in respecting the standards, but we need to understand the resources that we have. So the advantage is that standards can be directly monitored. We can already understand the situation based on the status quo. And these standards are quite logical, whereby we can work on an international web benchmarking. So these are the 5 HPH standards, as we have already seen. So now I will involve all of you on which of these topics do you mainly focus on. So here you can see the survey, and you can click with your mouse on one of the 5 standards. So on which of these topics do you mainly focus on? So please answer this question so that we can have our survey. I kindly ask the technician to tell us when we are ready. So please, you have to click on the standard that you are mostly working on right now. There you go. Here you have the answers. Most of them are working on patients, so standard number 3. A lot of people have answered the standard number 4. Thank you for your participation. We can continue. These are examples of improvement plans. Once we have understood the situation, we have to be creative in terms of organization. So leadership, demonstrating organizational commitment for HPH. Is our organization implementing the HPH vision as part of its overall organizational strategy? This is the experience in our region where we have some problems. If one of the objectives was to create working groups and company committees on different standards, the planning also envisages to submit by the end of May to the company committees the self-assessment tool, the self-assessment manual. So we are now implementing the standard on self-assessment manual. So by the end of September, companies, after the self-assessment, will have to send us the results. This is another example of our organizational commitment concerning the definition of substandards and the role of coordinators. Here, there's a regulation that was signed in 2018, whereby we need to have tools, working methodologies, and dedicated training, so that we can have job descriptions of regional company coordinators and company leaders. So we need to have a map in order to understand how this complex system works and in order to understand what we can do. And this is also required by the self-assessment tools, saying that we need to be clear about who does what. So this is a map showing that there is a multidisciplinary company committee identifying the people that need to be involved in the self-assessment and to collect the information that sometimes are a bit everywhere in the different departments in the organization. This is yet another example in Rome, the integration of the HPH standards into the equity plan. So the population has specific needs. These substandards assesses the systematic monitoring of the health needs of the population. The equity plan wants to implement this protocol, and so the HPH standards can be useful to that purpose. And this is ensuring access to the different services. Here you have a list of the substandards, fighting against vulnerability and decrease inequalities between vulnerable population. This is what is being done in Rome. Since 2017, they have been working on the health of vulnerable migrants with a specific hospital, and they are organizing trainings in the different local health care authorities. They are working with the National Health Institute to integrate the standards. So it is very important to work as a network. This is the third standard, enhancing people-centered healthcare and user involvement, on which you feel most involved in the survey. Here, the colleague of the Piedmont Network has underlined these two important initiatives concerning the establishment of a document enabling citizens to have access to chronic disease health centers. And there is a document on the Turin recommendations. Implementing the New Haven recommendation concerning the partnership between patients, families, and citizens to increasingly involve citizens. And this is a document on the Turin recommendations that you can use also to work on your self-assessment. So there's a formal agreement between HPH and the citizens to create communities that are aware of their rights. This is yet another example of the pediatric hospital Bambino Gesù, involving different associations like the Volunteers Association into committees that are organized in hospital. And this is another initiative on the collaboration between the committees and the Parents' Council and the Adolescents' Councils. They are involved in order to understand how they live their care pathways and what are the areas of improvement. This is the HPH data model in standards 3.1.2 concerning patient health. This is a model developed by Professor Hanne Tonnesen, which circulated a video that you can find on our regional network website, where she provided scientific evidence showing the need to use the HPH data model. And we are currently discussing on how to adapt this model to our territory. We have already worked a lot on professionals' well-being. During very difficult times, the assessment of the health needs are used to promptly identify possible requests for support. So this is a topic on which we've been dealing with for quite a few months. The medically unexplained symptoms. These are physical symptoms that do not lead to a very effective diagnosis. However, they create inappropriate access to our services. And we have made a survey in June 2020 that also affected our professionals. So 97% of professionals, operators, had a couple of these medically unexplained symptoms. And you can see here the questionnaire that has been validated at an international level. They have to do with different disorders and different trouble, fatigue, mood disorders, sleeping problems, drowsiness, anxiety, apathy. So on the right-hand side, you can see, let's see, the Bible of the stress model made by one of the international experts. And these are the this is the HPA axis, and this is the systemic sympathetic system. If they are activated for a long time, for over 6 months, they can damage organs, leading to a chronic inflammation. So this is a questionnaire in English. This shows that these symptoms that nobody takes care of, I mean, nobody considers them. This is a general syndrome, and it has been shown that these symptoms are caused by inflammation, leading sometimes to medical exams which are totally inappropriate. So during the pandemic, we have used one of the standards that we have developed concerning the involvement of the competent physician. And so sometimes the doctor has too much work to do, doesn't have time to deal with these symptoms. And so we have proposed a multi-professional equipe, staffs that can measure through these devices these medically unexplained symptoms and the impact that they have on our body. So this has been very helpful for doctors and health professionals. They are now using this service, and this is also a mechanism to increase patients' empowerment. So we have provided some behavioral advice based on a lifestyle, for example, and this initiative has been very successful. If any one of you is interested, you can read this article that was recently published. It was published last year. To conclude, this is Standard 5, promoting health in the wider society. This involves also environmental sustainability, but also we can work with research institutes and universities to ensure compliance with the standard. So this is an experience of a colleague from Turin. They are now collaborating with the University of Turin to work on standard number 3. And to provide instructions to health professionals that have to rate what they are doing. So that more stringent criteria can be defined. So we will share this culture. And this is yet another survey, the second survey for all of you after my presentation. So this is the question. Among the 5 HPH standards, on which of them do you personally feel there is the greatest urgency for improvement? So after I have explained the standards to you, on which standard do you personally feel there is the greatest urgency for improvement? Where would you like to invest more after this webinar? What would you be most interested in studying, in using in your work? There you go. As I thought, standard for creating a healthy workplace and healthy setting. We've been saying that for a long time. We can't work for other people if we cannot work for ourselves. We are not Superman and Wonder Woman. We need to have a healthy workplace, and we need to take care of ourselves in order to take care of others. We need to be empathic. And in order to be empathic, we need to be well. And so this is my take-home messages. We live in an age of complexity. We need to promote health also under difficult conditions. We don't have to suffer from a change. We needed to understand the change. We can train with the self-assessment tool. We can have an exchange with our colleague, but we need to have a mandate from our company to do so. So thank you for your attention. Thanks to all of you, because it's been exciting to participate in this first webinar. These are some useful websites for you. That you can share and you can use. Thank you. Thank you very much to Dr. Aguzzoli for this presentation. It was a really cross-cutting presentation. It touched upon many different points, and it talked about many strategic issues. So the point concerning the staff is very, very important. We have to give our staff a way out. You never have a second chance to give your first impression. So health professionals sometimes suffer from a very high turnover. They move, they go and work for different hospitals. Users have changed a lot over the years. They are subject to many risks when they work. Sometimes they change their career. We are brain-intensive companies, I have to say. So we have to motivate people. We have to focus on the sense of belonging of our professionals. We need to motivate them to work. So oftentimes we work on managing the facility, we work on procedures, we work on care pathways, but we don't deal with the people. We don't deal with the professionals. We don't work on professionals that have to interact with patients. And I think that this is an issue. During my career, I have been managing many different hospitals. I have opened many hospitals. The hospital is like a house. You know that in English, there's two words, home and house. The house is important because this is the facility, this is the structure. We have hospitals that have to comply with the rules, that have to be built in a certain way. But this is not enough. The home is also important. We have to make sure that the hospital is like a home for the people working in the hospital, where there are close relations with other people, where there are drivers, where people can feel well, can work well, can feel well-being, can feel that they are well. Not just patients, but also caregivers, professionals. So this is a challenge, I think. And the HPH is very important. The HPH is an important challenge. So thank you to Dr. Aguzzoli for her contribution and also for the examples and for what she has been doing in our region. Hopefully Friuli Venezia Giulia will be a pilot region to then extend our experience elsewhere. We have some 10 minutes left. Unfortunately, then I have to go away in 10 minutes, but I don't know whether there are some questions in the chat for the speakers. Yes. To Dr. Aguzzoli, there's a question. Given your experience and knowledge, at a time where it is very difficult to identify the priorities in healthcare, what is the difference that can be made by the HPH? So what is the difference between joining the HPH network or not joining the HPH network? So I've been governing this network since 2003. So I fell in love with this approach, with the HPH approach, whereby we can be very creative in terms of organization. We don't only follow the instructions coming from the ministry, but we can be creative. So this is the difference. So I have seen the difference over the past 20 years. And I have made difference where I have been working. Now I'm working at a regional level, but I was working at a local level, at a territorial level. And I was helped by the International Secretariat, by the General Assembly, and by the international colleagues with which we have always had a debate. And we can exchange ideas and opinions very fast. So joining an international network is very important, because as we have seen, the problem of staff is not just an Italian problem. It's a global problem. It's a problem that all countries have. And we can have an exchange with professionals from all over the world. So I think that the HPH network is unique because it is very friendly. It is everywhere in the world. And so the difference between joining or not joining the network is that if you want to be protagonist of the change, you have to join the network. If you want to be an agent for change, you have to join the network. Okay. Thank you. I also appreciated the fil rouge and the common areas that you've touched upon in the different speeches and presentations that we have had. So you have all focused on the role of the HPH network. There are some other comments and questions on the community. This is also very important. The healthcare system today must be community-based, as in we have to enhance the local communities in the healthcare setting. We have to act local. And if we have to act local, it is not enough to have facilities. It is not enough to provide services. We have to be community-based. We have to act community-based. Let's think about the role of volunteers, the role of caregivers, the role of the informal networks of mutual support. A lot can be done at a local level with that. There is a question to Professor Grown. At the next international conference, what will you be speaking about? Will you be speaking about the staff well-being, the operators' well-being? I was the one, Christina was the one asking. So, Professor Grown, what will you be speaking about at the next international conference? Will you be speaking about the operators' well-being? The question is to you.
Yeah, so I can't really say so much about it because the program is still being developed. We've got an overarching theme that relates health promotion to the idea of well-being oriented systems. As you know, for example, the Organization for Economic Cooperation and Development is changing its way. It's looking at health systems. The OECD has in the past counted a lot of numbers of beds, numbers of staff, numbers of doctors per 100,000 and so forth. And these numbers become increasingly, well, less relevant. I don't want to say meaningless, but less relevant, because it's really how you use the resources in the system to work towards relevant outcomes in terms of well-being oriented care. So that will be the overarching theme. We've got a scientific panel of experts that is currently developing the program. We've invited a lot of prestigious speakers, but the program is not out yet. If you've got any suggestions, please write to us and we will forward that to the conference organizing committee.
Molto bene, molto bene. Quindi,
okay, thank you. Thank you very much for your reply. Hopefully, at the next international conference, we're going to focus on this strategic issue. Are there any other remarks or questions? Mr. Aguzzoli, would you like to say something? I would like to understand from our Catalan colleagues. We have created HPH committees, and these HPH committees are not working on accreditation. I want to ask Christina or Manel, do you have HPH groups working on accreditation. How have you been organizing things between the HPH groups and the accreditation? And do you have any advice for us on how to work for accreditation? We are missing this part. I mean, how are you working for accreditation?
Yo?
You first, Cristina.
To you or you? Yeah.
You, Cristina,
yes.
first. And after
First of
me.
all, to say to all Italian colleagues that the accreditation is mandatory. So that means that for chief executives of the organizations, that means budget. So this is the key of the introducing the standards of health promotion in accreditation, because it's mandatory and we receive the budget depends on this accreditation. So this is the idea. So the accreditation is close to the health department, is for all acute hospitals only for acute hospitals. My hospital, for example, it's acute, long-term care, and mental care. This is only for acute hospitals, but our network wants and are improving all these health standards for all members, independent of the accreditation. Manel, if you want to add more information.
No, usually in the hospitals, there are a working group that work in the implementation of accreditation standards. And that working group sometimes have a member that collaborate in the working group of HPH. And this is the link that facilitates the implementation into the quality standards of the accreditation model of Catalonia, the standards of health promotion.
In this case, the Catalan network has influence to the accreditation. We have introduced the health promotion standard. So the Direttore Generale, I believe that you understand very well when the chief executives receive the new accreditation, and that means budget. So all organization wants to introduce these standards.
The successful is to introduce some that I present, some health promotion standards into this model. This is the successful for us because this facilitates that we can work in our organization these standards.
The new agenda is also health promotion and also sustainable, the responsibility social corporation. And I believe that the new generations wants to work in a healthy hospital and also in a sustainable hospital. And I believe that in the new generations wants to have in the hospital a hospital that is healthy and has health programs for them, for the professionals, has said the Direttore Generale.
Because we are also commitment with the objective of the WHO.
In Catalan hospital, actually, there are many health programs related with the WHO and has many activities like, for example, Nordic March, mindfulness, diet, how to improve I don't remember how you say dormir. Dormir is, can you help me, Oliver?
Sleep,
is
no?
dormir, sleep,
Good sleep, no?
Good sleep, no, activity, well-being, no? But this is real, the new generation in the hospitals ask for them and wants to look at this, and also a sustainable hospital that it's aware of the climate change also. This is in Catalonia, eh?
Yes. Not in all Spain.
Not in all Spain, Catalunya.
Grazie, grazie davvero per le vostre...
Thank you very much. Thank you very much for your contribution. Now, the CEO will now have to pave the way for accreditation. Yes, this is something we have to start working on. We have to pursue this objective. I have something to ask to Professor Grone. Now, we will continue with the second step of the practical self-assessment. And we have some problems because we don't want to be too subjective and saying from 0 to 10 if we comply with the standards or not. Can you give us some advice? Maybe do you have an example of some other country that has already been doing the self-assessment? Because maybe, I don't know, maybe you can risk being too subjective when doing self-assessment. Maybe one is very positive and says, okay, I'm very good, I'm complying with the standard. Another one is very negative and says, okay, I'm not complying with the standards. Do you have any examples of other countries that have already been working on the self-assessment? And can you tell us something? Professor Grone.
Yes, thank you. There are examples of countries that have already used the standards. However, I don't have exact information on how they took decisions when assessing the standards. But what is very important, and that is described in the document, is that the assessment should be done by a team. It's not a single person going through the standards and say, well, this is rating 2 out of 10 and that one is rating 5 out of 10. It should be a team, and the team composition is described of doctors, nurses, managers, administrators. All of them having an overview on the health service, and they should sit together, gather the evidence, and then come to a consensus. So it's still subjective, as you say, but it's a subjective assessment of a group rather than an individual person. And the fact that it remains at some level of subjectivity is not a problem as long as we stay in a quality improvement perspective, because these self-assessments should guide the local team to develop an action plan to improve and then revisit the assessment later on in the future. And then the same team can look at the assessment and says, okay, here we have improved a bit, and now we give us a few more points. That is different if you use those quantitative values for a kind of external assessment. If you ask all agencies to assess it and then compare and rank, then of course you need to have a more objective assessment. And perhaps that requires then some work to go through the list of measurable elements and state for your system, for your country, for your region, what you expect to be meeting in order to get compliance. It is difficult to do this at the international level because the countries and the systems are so different. But I suggest if you put a lot of value on the quantitative assessment, try to agree on what you need to have in place in order to get from 1 to 3, 4 to 6, and 7 to 9. And I'm happy to act as a sounding board if you've got any further questions. I think we can't do that here now, but if you've got any kind of working documents, I would be delighted to have a look at that and discuss with you further.
Molto bene, grazie. Allora, io ringrazio tutti I partecipanti.
Very well, thank you. I want to thank all the participants, all the best for your future work. Hopefully this is going to be just the first webinar of a series of many. Thank you very much from the bottom of my heart, and all the best to all of you. Thank you. Thank you very much to you all.
Arrivederci.
Ciao,
Thank
arrivederci,
you.
grazie.
Grazie. Ciao, ciao.
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 Grazie. Grazie Cristina.